Hello, my name is Tamika Hines. I'm a DNP candidate at Jacksonville State University in NU 715. Today I will be presenting a quality improvement initiative, turning our ship around for the stakeholders of BCS. BCS had services over 22,000 students in inner city Birmingham. We stand on four pillars to promote student success that are pillar one, student success, in which all students are prepared to be productive citizens, college and career and life ready. Our graduation rate increases as students in our schools meet or exceed proficiency in grade level reading, math, and other subjects required for graduation. Students are co-creators of personalized academic and life goals whose voices are heard in the learning process as they develop strategies for perseverance and problem solving. Pillar two is around team success, instructional leadership at the district and school levels in a stable and high quality environment. We recruit and engage development and retain high quality employees in all categories. Pillar three is stakeholder trust, which supports an increased communication efforts and channels for parents, families, and community members are better informed, more engaged, and have an increased impact on decision making. Our schools and district employees have positive perceptions of services and communication across our district. Pillar four is effective systems and planning, and we maintain or increase student enrollment. We look forward with a multi-year financial and facility plan that encompasses enrollment, revenue, facility conditions, and needs. You will find that this quality improvement plan seeks to embrace the whole child, addressing the mental health of our students, which ultimately will support the four pillars. Our vision is a vision for practices to improve child health by implementing evidence-based health programs that support the whole child, aligning with the four pillars as discussed previously. What steers our vision? Who will lead our quality improvement effort? We will develop a quality, and we have developed a quality improvement committee. This quality improvement committee is supported by the Student Support Services Department of BCS. That department is inclusive of the Child Health Department, Social and Emotional Learning Department, our 504 coordinator, our Special Ed Director, Counseling Director, Student Success Director, Principal Representative, as well as a Teacher Representative. Our duties and responsibility of the QI Improvement Committee is to implement a robust school-based mental health program to support the students of BCS. What meeting structures did we use? We used a decentralized interdisciplinary team in which all members had equal voice in sharing ideas and leading and guiding the principles of practice that are to be implemented within this program. Each individual would use their expertise to guide the area of practice that would be discussed. How often did we meet, and how will we meet, and when will we meet, and will we have a special retreat? The team held predetermined meetings bi-weekly at our departmental conference room. We do support a special retreat annually to review our QI project to ensure that we are on the right track. The issue defined. First of all, in BCS, we service over 22,000 students, and in this inner city school district, we find that there are so many underserved children within the community. According to the Child Mind Institute, reports that half of all mental illnesses occurs before the age of 14 and 75% by the age of 24, highlighting the urgent need to create a systemic approach to the problem of mental health. Among youth, the prevalence of mental health and addiction disorders is roughly 20%, yet youth are challenged to access evidence-based services in a timely fashion. So we implemented a school-based health clinic in school year 2019. Of the 277 total students that visited the BCS school-based clinic, 56.3% of those were there for behavioral health therapy. So that leads us to note that there is a need for more school-based intervention plans. And our plan involves a plan, do, study, act. And we plan to integrate mental health service into a local high school. We hope that this will produce student support and treatment for undiagnosed and undertreated mental illness. We will implement the clinic at the project school. Then we will develop robust and implement robust training and referral plan. We develop a policy around the mental health referral process with an objective to provide guidance for students' referral for mental health service. And in this policy will be used to identify when students will need referrals to school-based mental health services. The referral tool will be used alone or in conjunction with classroom observation and documented behaviors. This process and communication tool will be used for communication to parents, report summaries of care, in addition to out-of-facility school referral. So we want to clearly define mental disorders. And according to the CDC, mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, which causes distress, problems getting through the day. Individuals that will have some responsibility in the referral process will be the teacher, who will be our first point of contact that may identify when there are changes, when students have behavior changes. They will then refer to our school counselor. Our school counselor will plan one-to-one student sessions 3 times a week. Attend classroom observation, report concerns to parents, obtain consent for mental health treatment, and send referrals to the mental health therapist. The mental health therapist will then review referrals, contact the parents for intake information, develop evidence-based intervention plans for students, schedule therapeutic sessions with students as needed, and referrals to hospitals for inpatient services if those are warranted. Our student referral will be required to transition of care between teacher, counselor, and the school-based health intervention clinic. And that those interventions will be student-specific and contain the following minimum elements: the student's name, date of birth, a medical record, their behavior, allergies, any pertinent clinical data, signs and symptoms, referral comments, pertinent medical information. Also, receiving clinician will have an opportunity to ask questions or seek additional details if desired. Our resource allocations. In this plan, there will be no cost to implement this school-based mental health clinic. The district will thereby save $365,000 annually to replace an existing contract with a mental health provider. Also, it will impact student outcomes through the coordination of care, alignment of financial incentives with outcomes, electronic documentation, e-prescribing, and joint team accountability. We will generate performance data through evaluation tools and clearly define clinical advancement criteria. The school-based mental health clinic is responsible for maintaining a triple aim quality assurance measures to support their function and operation. Performance measures will be conducted by an assessment of current performance progress through the collection of analytics and reporting of data to the quality improvement team. The tools used will be an employee and student appraisal, as well as parent appraisal, productivity records, and student and parent feedback. Communication and education. This policy will be communicated to the appropriate BCS school personnel via the following channels: through PD and in written form. The policy will be distributed to BCS Board of Education, Superintendent, nursing staff, and Department of Nursing, as well as committees for dissemination to their specific department and staff. Updates and revisions will be communicated via the nursing staff, school counselor, teachers, and district publications. This policy will be placed in the policy and procedure manual on the BCS intranet system. Further education will be assessed by the number of staff referrals. We will also assess disciplinary reports, and the skills and knowledge that we would want our employees to develop will be how to identify clinical misbehaving or behavior changes, and when a student referral is indicated, the referral process and the expected student outcomes. The evaluation procedures, as noted above, will include patient surveys, patient and parent surveys, staff surveys. The data from these surveys will be analyzed and documented in a graph form for review. This analyzation of the information will be done by the committee on a quarterly basis, with adaptations made in accordance to the recommendation of the team and the feedback that is gained from our stakeholders. We will also rely on the interpretation of the data to guide future practice and future revisions of the school-based mental health clinic. These are a list of our references for your review. Thank you for watching, and I hope that you learned what you needed from this presentation. And now we are open to any questions.